We did this years and years and years ago on TV, didn't we?
Yeah, that's right. Actually, it was the first, I think, 6 months I was in practice that I did this with you.
Yeah.
And then didn't need it.
And he's been busy ever since. It's my pleasure to introduce you, if you don't know him already, Dr. Paul Zimmerman, Boone Podiatry here on State Farm Road. This guy does amazing things with feet. And you know, and you're going to be reading about him, if you haven't already, in our new edition of High Country Health and Fitness magazine. One of the things we talk about in the magazine, in the article, is how many people put up with foot pain.
Surprisingly, I would say most people think feet are supposed to hurt. There's some point in their lives that they get to their feet are supposed to hurt every day. And it's not the case. The case is simple that...
it's like any other part of the body. It shouldn't be hurting, right?
Exactly. And when your feet hurt, and I hear this every day, you hurt all over. But I also like to tell people that when your feet hurt, the reason you do hurt all over is because you're going to probably guard or limp or create some kind of gait imbalance that will cause your knees and your back, your hips to hurt as well. So it's important to take care of even little things with your feet.
You know, one of the amazing facts you'll see in the magazine with the article on Boone Podiatry is that there are about a quarter of the bones in the entire body are actually in the feet, right?
Yeah, each foot has about 26 bones, or 52 bones for both feet, and there's, I think, about 206 bones in the entire body. The foot has to hold up a lot of weight, and so it has an unusual kind of arch support system that involves multiple bones in your midfoot, and there's a lot of things that can go wrong, but there's a lot of things that go right with feet too.
Yeah, I think a lot of people think if you soak your feet and they still hurt, well, they're just going to hurt. But there are some fairly simple things that they can do that you can do once they come in and visit you, right?
Well, depending on what the problem is, you know, one of the more common things that we see is heel pain. I have a little needle point in my front office here. It says, "Time wounds all heals," which seems to be the case, because some days it seems like that's all we see is heel pain, and it's something that's very treatable conservatively. You know, sometimes just changing shoe wear, stretching, a night splint, some simple things usually take care of the problem.
What about orthotic insoles? That's something, I guess, not really new, but new to a lot of folks.
Well, they've been around for a long time, forever. And there's a lot of different kinds out there, and there's the ones that you see in Walmart, what they call custom insoles, and there's also the ones that we cast your feet for, and we make a prescription related to your situation, your size, your activity, your problem, that are a little more effective in my opinion.
Boone Podiatry and Dr. Paul Zimmerman is really a one-stop foot shop, if I can use that term, Don.
That's a good term. If there's anything related to the foot and ankle, I'm very happy to see it, treat it. Anything from, broken bones to simple things like corns and calluses, routine care, wound care, diabetes foot care.
Diabetes really is a huge issue these days, isn't it?
Well, it's kind of an epidemic in the United States. There's about 24 million people diagnosed with diabetes, and they're expecting that's going to double within the next 10 years. And of course, with diabetes goes neuropathy, or nerve damage, and that's when people start having problems with their feet, not to mention the circulation problems that you'll see with diabetes. So, diabetes care is important because you want to avoid future problems. These patients just need to have their feet checked, corns and calluses trimmed, nails trimmed, circulation checked, and then when they do have problems, they have somewhere to come to, they know where to go, and we treat a lot of things related to it.
Yeah, and I think folks would be interested to know that haven't been here already. You do, if necessary, you do x-rays right here on the premises.
Oh yeah, we have x-rays, and we do small surgeries in the office, and we do outpatient surgeries at the hospital, Watauga Medical Center here. And we do some other kinds of new things, including the PRP, the platelet-rich plasma injection, which is basically taking blood from the patient, centrifuging it down into platelets and re-injecting it into areas that are inflamed or problem areas that seem to be very effective helping to resolve those problems more quickly.
What else is new in foot care?
Well, there is another new thing, and I hate to be using so many big words, but there's this extracorporeal shockwave therapy. We use an oscillotron machine, which is kind of like a sound wave therapy that we've been using for heel pain, Achilles tendonitis, plantar fasciitis. We do it at the hospital because it's a very big machine, but it's non-invasive, and it's getting similar results as surgical procedures. So it's a very good, relatively conservative solution to a lot of problems.
You've probably already caught on that Dr. Zimmerman really cares about his patients. You take your time with your patients. You really enjoy what you do.
I like what I do. I wish I could take more time with my patients, though, and sometimes it's hard, but I really do enjoy what I do.
Probably one other thing that you ought to know about Dr. Zimmerman's practice, Boone Podiatry, insurances are accepted here. This is just like most other doctors'
We
offices,
accept
right?
all insurances, file almost all insurances. We see patients of all ages, from babies to we have a 100-year-old patient in the next room here we might get to meet. And you don't have to have a referral to see me. You can usually just give a call and make an appointment.